today, and I have with me some beautiful constituents and residents. I'm going to let them each introduce themselves.
Hi, I'm Janet Dwyback. I live in Delray Beach, Kings Point.
Okay,
I'm Jack Goldstein. I live in Delray Beach, Kings Point as well.
okay.
Antoinette Miller. I live in Boynton Beach.
Dr. Julia Harris. I am a representative of the National Black Nurses Association, and I live in Boynton Beach.
Wonderful.
My name is Bill Sowers. I'm the president of the Florida Alliance of Retired Americans. I represent a little more than 200,000 retirees here in the state of Florida.
All right, we've got big shoulders there, Bill. Well, this time of year, tomorrow night, about 9 p.m., our President Biden will be making his State of the Union address. And every year I get to bring a guest, and I'm very excited to introduce, well, she introduced me herself, okay? And this is Janet Dwyback, and she really, I'll tell you about her in a second, but she's going to represent our nearly 200,000 people here in Palm Beach County who are on Social Security and Medicare. So that's what we're going to talk about today. Thank you all for joining me here. The nearly 60 million Americans, nearly 5 million Floridians, and over 200,000 people here in Palm Beach County rely on programs, Medicare and Social Security. And I know, Bill, you're going to give maybe a more exact number. And Janet has worked since she's age 16. She'll tell you about that. Since age 16, she started as a secretary. Later in life, she became a nurse and is retired now. And like the hundreds of thousands of other retirees here, deserves a good, dignified life. And she is relying as her sole income on Social Security and Medicare. And so I'm here to tell Janet and the folks behind me and those listening that it's going to be a fight, but I can promise I'm going to be fighting hard to protect Social Security and Medicare. And, why do I say that? First of all, these are two most important programs in the history of our country and are keeping millions and millions of seniors out of poverty and giving them the dignity they deserve and that they earn from their working lives. Our aging population is putting strains on both these programs, especially because people are living longer and healthcare costs are going up. And why do I say there is a threat? There is a threat because there are extreme Republicans in the Congress who don't want America to pay our bills and are threatening to hold out on what's called the vote on the debt ceiling, and that threatens paying our biggest bills, and that is to Social Security and Medicare. So Janet, you're going to meet my colleagues.
Yes.
And we're going to talk about this issue and make sure we get as many of my colleagues fighting hard to protect these very important programs. And with that, I'm going to bring you up to say a few words.
Hi, thank you, Congresswoman, for inviting me, and I'm really excited to be attending the State of the Union address tomorrow night. I'll tell you a little bit about my background. I lost my father when I was 12 years old, and because of Social Security, my mother, who had no other income, was able to collect at least half his Social Security. My oldest sister had started working then, so she was able to supplement, but when she left the house and got married, I was left to help take care of my mom. I was in a work-study program. When I was 16, I lived in the city, and I was a strap hanger riding every day into Manhattan. The following week, I went to school. And when I was 17 and graduated high school, I started working full-time. So I've been paying into Social Security since I'm 16 years old. This is my money. This is what is paying my bills. I never worked for a company or an organization that provided me with a pension. So I put my own money away. I saved and I saved. I am fortunate that I get a pretty decent Social Security, which pays my bills. It gives gifts to my grandchildren. And when I think of that being cut, what will I do? What will millions of Americans do if their Social Security is cut? I will still have to pay my homeowner's insurance, my car insurance, my home insurance, food on the table, a birthday gift to my grandchildren, which I can't give them anymore, unfortunately, but I do what I can. I don't want to be supported by my children because I know the dignity that my mother lost asking her children for money. So I am hoping, people say it will never happen. In nursing school, we learn to never say never, never say always, because there's always what if. And if that what if happened, I don't know what I would do. I don't know what so many of my friends living, especially in Kings Point, we're a senior community. Many of them don't get what I get. They get maybe other supplements. But again, what will I do? I'm thinking of me as well as thinking of everyone else.
Thank you so much, Jen.
You're welcome.
Okay, I'm going to bring up Bill. Bill, reintroduce yourself.
Hi, I'm Bill Sowers. I'm the president of the Florida Alliance Retired Americans. I am the only ARA president in the United States who's not retired. And I still work, and I am a licensed insurance agent in 4 states. So I would like to inform everybody about what Social Security actually is. Now, I'm just talking about Social Security. Social Security is an insurance program. It's an insurance policy. It was built on the same foundation as life insurance. And every paycheck you contribute and your employer contributes, unless you're self-employed, then you make the contributions on your own. That money goes into the Social Security Trust Fund. There's 2, one for disability, one for old age. And that money can only be used by Social Security. It can't be used for any other purpose. And it can't accept any outside money. The only money it can take in is whatever is contributed to by all the policy holders. When you start to collect your Social Security, they call you a beneficiary, because that's what we call people who receive insurance proceeds. So you've heard that it's not going to be around. That's mathematically impossible. It'll always be around. Now, it may not be able to pay 100% of the benefits. We might have to raise the cap, the earned income cap, in order to get there. And that's the easiest fix. And it'll make Social Security not only viable for years to come, but it'll also open it up to expansion so that we can have a lot of senior people now are taking care of elderly parents. And it's a financial situation that they have to deal with. And they should be rewarded for doing that, not penalized. So that's all I have to say about Social Security. Thank you very much.
Thanks, Bill. Thank you very much. Okay, come on, reintroduce yourself. Oh, go ahead. Just reintroduce yourself.
I'm Dr. Julia Harris, and I am representing the National Black Nurses Association of West Palm Beach, and I mirror almost everything that Miss Janet said. I have been a nurse well over 50 years, and I am on limited income living in a senior citizen community, and Medicare, I have Medicare that pays my health care bills, but Social Security is also making that payment for me. What am I going to do if that goes? And I've been taking care of people for a long, long time, and this is something we need to fight for.
Thank you so much. And thanks for your years of service. Okay, just reintroduce yourself.
Antoinette C. Miller. I'm from New York City, Long Island. Used to work for New York City Board of Ed with special ed, and also a member of St. Paul, Delray Beach. Biden, I hope that everything goes well with our commission, our friend Lois Frankel. Hope that everything goes well and that we secure everything and all of our benefits for Social Security and Medicare. Thank you so much.
Thank you. Okay. Thank you. Very good. Okay. They have a lifetime of stories. Anybody, any questions? We good?
Well, actually,
Yeah.
well, I guess I kind of touched upon, this is something that, maybe, people who aren't necessarily quite at Social Security age,
Yeah.
Why should they care about this now?
Well, first of all, I think there's probably not a person around who doesn't have a family member who's on Medicare and Social Security. And so if the United States, if we don't pay our debt, our economy is going to collapse, as will probably the world's. There'll be a crisis in the world. So, how many of you have children or grandchildren? You know, so I just because they're family members. Also, our senior citizens are an important part of our economy. You think about, especially Palm Beach County, who go into the 7-Elevens or the gas stations or the grocery marts. When we have literally here in Palm Beach County over 200,000 seniors, they're supporting this economy. So everybody should care that our retirees can stay healthy and dignified and live the life that they deserve after working for so many years.
So you're saying, I guess, if there actually were cuts, it would affect this area probably more so than,
Oh, yeah, well, you could say Florida would be dramatically affected.
like, how so? Like, what are some of the things that
Well,
could happen?
Florida, we have 5 million Floridians rely on Social Security and Medicare. Our seniors are huge economic producers, and we got to keep them healthy, and we got to keep them comfortable. Got it? Okay. Thank you so much.